a couple of people have spoken to the sort of, it's good to have more demonstrations, to have, more development of evidence-based models. And of course, as a researcher, I like that. But I'd like to hear the panelists talk more about, more than Barbara, who's already spoken to it, but what else can be done now by the states, by CMS, by HUD that doesn't require simply living with the current world in which we're very resource constrained and using whatever resources we have on model development. Carol.
I think we face a really interesting opportunity in the states that, politics aside, or at least in the states that where the politics allow the state to move forward with Medicaid eligibility expansion. I think there's a window of opportunity here in the next few years where under the terms of the Affordable Care Act, the federal government is going to pick up all of the costs for the Medicaid benefits for newly eligible folks. And in many cases, we're talking about not only adults without children who are living in deep poverty, but we're also talking about parents in families in deep poverty, dads and moms, many of whom have some real problems, who in many states haven't been eligible for Medicaid. So with the federal government picking up the tab for expanded Medicaid eligibility, it seems to me that where you've got people with a lot of problems, if we offer them the same standard package of benefits, we can have Medicaid dollars paying for a lot of avoidable trips to the emergency room, a lot of avoidable hospitalizations, and pretty bad health outcomes for some of those folks. Or we can say, here's an opportunity. States don't have either the fiscal capacity or, frankly, in many cases, I've met with lots of Medicaid directors who are working really long hours and they just don't have the time to manage the scale of budget reductions that they're facing in the state's fiscal environment and manage all of this change at the same time. So I think there is an opportunity here for the federal government to help states do some really innovative, really smart things in designing benefits, in testing some of these models of paying for things that look different from paying for emergency room visits and hospital visits, and instead pay for the kinds of services that can make housing resources work well and give states a little breathing room to experiment and try some of these new models. Frankly, I don't think that most state Medicaid directors are thinking in those terms right now because they don't have the breathing room to do that. But I think with the right set of signals from the federal government, the right encouragement and the right support, there's a real opportunity there to say, let's pay for something different and see if we get better results.
I certainly would agree with that. In states, some states are going to go through the analysis, as I mentioned earlier, about whether or not they should do this expansion. Then a lot of states are already in the planning process as to how they're going to do this expansion. And so this has to be part of the calculus again as to what's the best way to provide services to this population. You're going to hear about things like hotspotting and super utilizers. That's the terminology that's being used these days about identifying high-cost cases and introducing care management or care coordination or case management, whatever terminology you want to use, to make sure that that care is coordinated in an effective way. So that's what Medicaid directors are thinking about, is how am I going to manage my risk associated with this? Am I going to contract with managed care organizations, or am I going to contract with providers directly? And the health home piece is a critical piece. The states have the incentive, get 90% federal money for 8 quarters in terms of reimbursement for health home services, the coordination services. So in the context of health home models, they're going to identify these super utilizers, which means the top 5% cost cases. And that's where this whole issue needs to be, the issue of housing needs to be introduced.